After having discussed screening for cervical carcinoma, let's move on to another genital carcinoma, that is endometrial carcinoma, which is not that common in India. So there's a query, should endometrial cancer be screened? Here we know the precursor lesion of the endometrial carcinoma, which is atypical endometrial hyperplasia. And endometrium as such is accessible for sampling so that the test can be done. And in cases of endometrial carcinoma, there is a high cure rate for early disease. And majority of cases of endometrial carcinoma, unlike that of cervical carcinoma, are detected at early stage because of abnormal bleeding, especially in postmenopausal bleeding. So as far as the endometrial cancer screening is concerned, there is no standard or routine screening test, and the tools which are used can be pelvic ultrasound, in which, especially in postmenopausal women, if the endometrial thickness is more than 8 millimeter, then one should do endometrial sampling. And the second tool is the endometrial aspirate, which is in postmenopausal women. Usually there is inadequate sampling in spite of endometrial carcinoma being present. At times, the PAC test helps in diagnosis of and suspicion of endometrial carcinoma or atypical endometrial hyperplasia. Usually, the screening is done for high-risk individuals. The recommendations for individuals among patients with Lynch syndrome are based on the expert opinion. In high-risk individuals, surveillance by transvaginal sonography, hysteroscopy and endometrial biopsy has not proven to be of benefit. And risk of endometrial carcinoma rises significantly after the age of 40. Ultrasound is not likely to improve efficacy of screening for endometrial cancer when used in combination with sampling. The main role of ultrasound in women with Lynch syndrome is usually for ovarian cancer screening. Annual endometrial sampling and transvaginal sonography at the age of 30 to 35 years or 5 to 10 years prior to the earliest stage of first diagnosis of Lynch is associated cancer of any kind in the family has been advocated. So endometrial aspiration is one of the screening methods for early detection of endometrial cancer. And usually it is used in high-risk cases and those on tamoxifen or hormone replacement therapy. So aspiration can be done by various instruments. It can be a pipple curette, which has been shown in this diagram, Isaac aspirator, Vibra aspirator as an OPD procedure. There are various other curettes also available. And this is the thing done without anesthesia, and the sample is sent for the histopathology. So a simpler cost-effective method is to aspirate endometrial cavity with 4 mm Karman's cannula, which is shown in this diagram, which is attached to a disposable 20 cc syringe, and a negative pressure is created and the endometrial sample is collected. So, and the endometrial cancer screening is not justified in population screening as we have seen in carcinoma cervix, and there is usually an excellent prognosis of majority of cases of carcinoma endometrium, and even if we do screening, it is unlikely to result in decreased mortality rates. So that was about the endometrial carcinoma, which usually we screen in the high-risk individuals. And as far as the breast carcinoma is concerned, it is the #1 carcinoma in women, and the current age standardized rate is 19 per 1 lakh per annum. Incidence rate usually peaks below the age of 50 years, and cases presenting for treatment are usually locally advanced. So availability and level of facilities for treatment are variable from place to place and depends upon the socioeconomic status. Survival rates are consequently low in cases of breast carcinoma. So what are the screening tests which can be employed? They are mammography, clinical breast examination, and breast self-examination. So the two cornerstones of early detection of carcinoma breast are awareness of the disease and opportunistic and population-based screening. So screening mammography, I'm not going to go into detail since it usually will be discussed in general surgery also. So mammography reduces the rate of death from breast cancer by 7 to 23% with a median of 15%. So current recommendation is mammography, clinical breast examination and breast self-examination, widely used as tools to increase the breast cancer awareness. So, clinical breast examination may identify about 5 to 10% of breast cancers that mammography may miss, and the clinicians' proficiency impacts the effectiveness, and recommendations vary. As for the American Cancer Society says, it to be every 3 years for average risk women in 20s and 30s, and annually for women aged 40. And US Preventive Services Task Force, there is no recommendation from them because they say that there is not enough evidence that the clinical breast examination is useful for early detection. So, International Agency for Research on Cancer, that is IARC working group, it concluded in 2002 that there is inadequate evidence that breast screening by clinical breast examination either alone or together with mammography can reduce mortality from breast cancer. However, the National Comprehensive Cancer Network continues to recommend clinical breast examination intervals of 1 to 3 years for asymptomatic average risk women aged 25 to 39 years and annually for asymptomatic average risk women aged 40 years and older. However, cancers detected by clinical breast examination tend to be diagnosed at an earlier stage than those not detected by screening. So this is how the clinical breast examination is done. The details would have already been dealt in general surgery. And routine breast examination may discover a breast lump hitherto not recognized by the woman. That's why clinical breast examination is important. So this is the slide showing the how to do clinical breast examination, the palpation part, and this also must have been explained in general surgery. Breast self-examination. What is the clinical value? That experience has verified that 90% of breast cancers are found by women themselves. And when the women discover lumps in their breast at very early stage, surgery in these cases can save 7 to 80% of proven cases. So that's why breast self-examination is important. And women should be taught to perform self-breast examination and advised to do it usually post-menstrually every month, or in cases of postmenopausal women, one can identify one date, say 1st of every month. So monthly breast self-examination in menstruating as well in postmenopausal women is helpful. So this is a chart which shows the breast self-examination, and one can explain to the patient how to do breast self-examination. So breast cancer screening, what are the recommendation? All women aged 20 years and older should perform breast self-examination on a monthly basis, and all women aged 29 to 39 years should have clinical breast examination every 3 years, and all women aged 40 years and older should have regular every 1 to 2 years mammograms. Asymptomatic women aged 40 and above should continue to receive clinical breast examination, preferably be a part of periodic health examination annually. The screening decision for older women should be individualized by considering the potential benefits and the risk of mammography. So sometimes there is a disparities by the screening methods, why these disparities occur. A woman may have an inadequate access to facilities and equipment for various screening methods. There can be financial restraints. Suppose mammography is quite costly. It cannot be afforded by every woman. So, and including a lack of adequate health insurance. So that's why it's especially applicable in developed the countries. So they do have a health insurance and can undergo breast self-examination. In countries like ours, very few women will have health insurance, and that's why mammography usually cannot be done. Usually is not done. So then the lack of patient knowledge of breast cancer cervix and the need for screening. Usually an average woman will think, why should I undergo the breast screening? And any mass in the breast is usually regarded as carcinoma until proved otherwise, which is usually not true. And patient education is the key for early detection of breast cancer. So that's why patient education is very important, to emphasize upon the breast self-examination and clinical breast examination.